Hi, I'm Melinda Tasqueta-Mullane, Editorial Director of Imaging Technology News, and we are here at SIIM 2016 in Portland. And with us today is Dr. Rasu Sherestha, who is the opening keynote speaker here at SIIM and also SIIM Treasurer. So welcome, Doctor. Thank you for being here with us. Yeah. We're going to talk with Dr. Sherestha a little bit about leveraging innovation to drive patient-centered care. And Doctor, in your opening general session, you talked about how imaging is at a critical juncture. Can you elaborate on this a little bit for us?
Absolutely. If you look at where we are in imaging today, we've really had almost about 2 decades worth of brilliance in embracing technology and moving from film to filmless and going from analog to digital. But we're at a critical juncture because there's a lot of talk about moving from volume to value, right? What we need is action, right? We need to make sure that we define what value is. We need to make sure that we're creating the solutions that would further enhance the value of radiology and radiology services. And that's what I talked about. And the need for us to then do that by focusing on quality and outcomes, and what's most important, which is the fact that behind that film that we're interpreting, behind that monitor, really is a life, right? And so having more of a patient-centered view to what we're doing, really transforming the specialty as a whole from where we're just report generators to where we're physician consultants, really having the patient as the central focus, not the image, not reason for exam, headache, right? But having the patient as the center focus of what we're doing and how we're doing it really is critical.
Great. And what dynamic changes are facing the industry today?
So what we're seeing in imaging is that reimbursements continue to decline, right? Costs continue to escalate as well. Everything's getting more expensive. But at the same time, we're getting paid less for the same procedures that we did even a year or 2 years ago, but we're getting paid less for them. We're also being inundated with data. Right? But as a radiologist and as someone in informatics, I can tell you we're data rich, but information poor. Right? As a radiologist, I'm more of a detective than I'm a clinician. I'm struggling with trying to piece information together and all of these clues that will help me get to the end of that read as quickly as possible. And I think the focus is wrong. We mean well. We really want to do what's in the best interest of the patient, but our workflows and the systems that we currently have and the way that they're designed aren't optimized for patient-centered care and value-based imaging by the definition of how we're trying to push these things forward. So I think it's an opportunity for us, right? So you've got all of these different dynamics that we're facing, yet these needs around value-based imaging, so it's an opportunity.
How can we rethink the care paradigm along with imaging's role in leading change?
So what's interesting about imaging is that we've been at this for a while now, and we really are leaders. We've been leading change in the embrace of digital. We were first amongst clinical specialties to really embrace the digital form factor, and we created PACS and the information systems that we know today, and we had DICOM in 1983, right? We had PACS systems before meaningful use came to be, and physician practices started going from paper-based charts to electronic medical record systems. So we've been at this now for a while. I think what's really important is for imaging across the board, radiologists and other imagers, to sort of reawaken and lead once again, right? Because when we talk about value-based healthcare and the imperative for us to focus on quality, imaging is a critical part of the diagnostic process for almost everything. We're a common denominator for almost every patient that walks in through a healthcare institution. So it's really important for us to bring that value out.
So what is key for innovation and reinventing value for imaging?
So there are several things that are really important. I think challenging the status quo is really critical, right? So it's not just about thinking outside the box, but really challenging the status quo, challenging assumptions, right? Turning things on its head and asking the hard questions, I think that's really critical. I think we've designed systems for regulations, which is not bad and it's fine, and that's what we set out to do, and we've done it, right? But I think we need to design systems for empowerment. We need to design systems to empower patients, empower clinicians, radiologists to really bring out their value. And then the way to do this really is we need to embrace principles of design thinking, right? Leveraging empathy, bringing the end user in the design of the process itself and the systems itself, not at the last minute for them to test out the solution that you've already created, but even as you're thinking through the pain points, having the patient or the clinician, radiologist and others involved up front. So it's a whole different way of designing solutions and rethinking what health and healthcare really means.
Thank you so much for sharing your insights with us. We appreciate it.
Yeah,
Thank
very
you.
much.